Thanks very much, Spencer, and it's a pleasure to be here, and to all the people that I can see and all the people who can only see us on the webcast. It's very impressive that so many of you are interested in learning what you can about this issue. As Spencer Turnbull mentioned, I am the director of the Center for Medicare and Medicaid Services Center for Program Integrity, and this represents an opportunity for CMS to extend its partnership with law enforcement in several important ways. We continue, of course, to do everything that we have done in the past with law enforcement, and hopefully doing it even a little bit better, largely in terms of helping them build cases and do data analyses and all the other things that involve support for their case building. We're also complementing that now with an emphasis on preventing fraud and waste and abuse in the first place. And that's my principal focus today. I'm going to talk to you mainly about not just what we're doing with law enforcement, because that's a very extensive partnership, and you've heard a lot about that so far this morning, but also what we're doing in terms of preventing problems from happening in the first place, and second, in terms of the administrative actions that we take within the Centers for Medicare and Medicaid Services that are short of, or different than, I should say, the kind of law enforcement activities where you might face, guns and handcuffs. So the Center for Program Integrity was established by Secretary Sebelius a little over a year ago, and for the first time it brought together within CMS the program integrity functions for both Medicare and Medicaid. And that has proved to be extremely useful to us in terms of consolidating and coordinating program integrity policies and activities across both of those programs. We recognize that the vast majority of the people that we deal with every day are legitimate providers and suppliers and people that deserve to be treated that way and be treated respectfully. And we want to do whatever we can to minimize any unnecessary problems from our program integrity activities. On the other hand, of course, we want to do our program integrity activities as effectively and efficiently as we can. So bringing together Medicare and Medicaid activities under the same roof has proved to be valuable in terms of being able to look at both programs, the activities, the policies in both programs, and with an idea towards what can we do to make them not only work better, but work better from the provider perspective as well. It's a very high priority for us. Under the Affordable Care Act, we have a number of important new authorities that have been implemented that support the activities that we're undertaking at Center for Medicare and Medicaid Services in program activity. And one particular one has to do with our focusing on the real risks that we are facing. We're facing very different risks from the kinds of organized or not so organized criminal elements that have invaded Medicare and Medicaid programs on the one hand, all the way to honest mistakes made by legitimate providers on the other hand. And everywhere along that spectrum, we intend to apply our program integrity tools and structure our program integrity interactions in a way that deals with the actual risk that we are facing and doesn't treat everybody the same by any means. That's one important principle of what we are doing. Second important principle for what we're doing in the center has to do with what I mentioned originally, which is coordinating and consolidating the activities across all of our programs. A very important aspect of what we're doing, and I'm going to spend a little bit of time in just a few minutes talking more about this, has to do with innovation. We are bringing the CMS activities with respect to program integrity into the 21st century, let's say, in terms of the kinds of approaches that we are taking, the data systems and analytical tools that we're implementing, the way that we're going about doing this. And I think that all of you will find as we talk more and more about this and as we move into that phase of things over the next few months and year or so, that you will find that our ability to do things in a way that serves our purposes and serves the interests of legitimate providers and suppliers better will be supported. Another very important principle for us is engaging our private sector partners, and I think this work by the Office of Inspector General to have these compliance training sessions and to bring in the private sector really demonstrates our interest in collaborating better with the private sector and in terms of getting your input, but also your actions to help support the things that need to be done in order to root out and prevent fraud and waste and abuse in the first place. We've had a series of regional fraud prevention summits. We've got one coming up in Philadelphia on June 17th. Those are major initiatives to engage the private sector, to engage the beneficiary community and the provider community, as well as the law enforcement groups in each area. And that reflects this high priority of ours to work more closely with the private sector. And finally, of course, is accountability. This is an administration that's very big on accountability. And as we set out to improve our program integrity activities, we're also laying out what our goals are, and we'll be held accountable for reaching those goals. I'd like to, I don't know if the camera can catch him, but I just want to illustrate one tangible aspect of that embodies our commitment to improving our work with the provider community, and he's sitting back there, and that's Dr. Shantanu Agrawal, who has, one of the things that I did with the Center for Program Integrity was recognize that we would be much better served in terms of working with the provider community if we had a physician other than myself who could really dedicate himself to the provider liaison and interaction kinds of activities. So I created the job of medical director within the Center for Program Integrity, and Dr. Agrawal has joined us recently and serves that purpose. And he will be the point of first contact for the entire provider community, focusing on not only hearing what the concerns are of the community, but also in terms of what we can do to work with you along these lines. So it's an important development within CMS and an important development within Center for Program Integrity. One of the things that Dr. Agrawal was brought in to do is something that's very important to us, and I know is very important to many providers around the country, and that has to do with better systems for both preventing and responding to provider identity theft. We've had a series of unfortunate incidents in different situations around the country with provider identity theft. We've actually now created a compromised beneficiary database and a compromised provider identity database that we're using as part of our advanced analytics. But there are human beings involved in these situations, and when a physician or another healthcare provider has their identity misappropriated and somebody's using it for fraudulent activities, that creates tremendous problems for the individual whose identity has been stolen. So we want to make sure that we're doing everything we can to keep that from happening, but also to have responsive systems that will deal with it when it does unfortunately occur. Another major initiative that we're taking that has a lot to do with the interests of the provider community has to do with our reforms to our enrollment systems. Our enrollment systems are tied directly to our new screening requirements. We're making it much more, we're conducting much more thorough screening of the 19,000 new applicants every month to come into Medicare to be able to build a Medicare program. And we want to do that in a way that, as I said, the vast majority are legitimate people. We want to serve their interests. We are in the middle of reforming our enrollment system at the same time that we are implementing our new screening measures. The Affordable Care Act does require all providers to have compliance programs in place. You've heard a lot about that today. We are working through that process in a stepwise manner. We published a request for comments. We got a lot of comments from the provider community on the two issues that we were the most interested in. Number one, how to improve the programs that all of you have already put in place based upon the voluntary programs that the IG has established for some time, but also how to go about requiring compliance programs, what makes sense for small providers, for individual solo practitioners and so forth. So we have not yet published the notice of proposed rulemaking on that front, but that will be forthcoming, and we will be taking into consideration all of those thoughtful comments that we got. I want to just touch on two other things now. One is to give you a sense of the kinds of administrative activities, actions that we take at CMS when we do encounter problems. We want to prevent the problems in the first place. But when we do encounter problems, there are a number of things that we can do. The Affordable Care Act gives the Secretary the authority, in consultation with the Inspector General, to suspend payments when there is an investigation of a credible allegation of fraud. We believe that this is an important new tool, new authority, very valuable one. We also think that it's important for us to be thoughtful about when an allegation is indeed credible enough to warrant suspending somebody's payments. And we will be doing that in consultation with the Inspector General. We, of course, have a variety of ways that we can take a closer look at payments before they go out the door, and our advanced technologies are going to be of great assistance in doing that. We are looking very carefully at people who don't belong in the program in order to revoke their Medicare billing privileges. That's an initiative of ours, again, targeted to people who clearly don't belong in the program. There's a new requirement now that will affect people who are excluded from the program or otherwise terminated for cause, either by Medicare or by one state Medicaid program, and that is they'll be terminated across the country by all state Medicaid programs. So that's another important new authority to keep bad actors, if you will, from just moving from state to state. And there's also the new screening requirements that were put into place by level of risk of committing fraud and abuse and applied by category. But when the Inspector General excludes somebody from the program, or somebody gets convicted of certain felonies, or certain other actions are taken against them, they as individuals can then be put into a higher screening category if and when they reapply to get back into the program. So these are the kinds of administrative tools that we have, and I'm being subjected to an administrative tool right now, which is a hook. So I will say one last thing, which has to do with our National Fraud Prevention Program. This is the application of highly sophisticated technologies that will allow us to do analytics way beyond just doing yes-no kinds of screening on individual claims. This will allow us to take into account many different aspects. For example, how far apart are the provider addresses and the beneficiary addresses? Are they unreasonable, at an unreasonable or an impossible distance? And to look at 25, 50 different kinds of things all at the same time. This will make us much more effective in terms of identifying the bad guys and taking action against them, but it will also be much more likely that we will not have false positives and that we will be truly targeting the bad guys, the ones that we do need to do something about. So thank you all for your attention. I appreciate it very much, and I guess we'll be staying around a little bit afterwards, Spencer. Thank you.